I'm Jonathan Kay from the University of Massachusetts in Worcester, Massachusetts, here at the American College of Rheumatology meeting in Atlanta, Georgia. I heard a very interesting plenary presentation today, abstract 1758, given by Dr. Hemsvold from the Karolinska Institute in Stockholm, Sweden. She described the RISK-RA study in which 268 patients were recruited who had anti-citrulline protein antibodies and joint pain but not arthritis. This is a tremendous number of patients to recruit with this pre-arthritis clinical presentation. They assessed these patients and made sure that they didn't have clinical evidence of arthritis, and then looked at various risk factors for the development of arthritis following these patients over at least 2 years. They found that individuals who had these anti-citrulline protein antibodies and also rheumatoid factor were more likely to develop arthritis than those who had no rheumatoid factor but the anti-citrulline protein antibodies alone. They looked for ultrasound detectable synovitis as their endpoint and found that about a quarter of the patients developed arthritis by 2 years. When they looked at risk factors, they found that the presence of tenosynovitis on ultrasound at baseline predicted the development of inflammatory arthritis with a 3-fold increased risk compared to those without tenosynovitis. The presence of antibodies to citrulline filaggrin increased the risk of developing arthritis by 2.5-fold, and the presence of increased levels of interleukin-6 increased the risk by about 1.5-fold. When they looked at the number of antigens to which citrullination was, a number of anti-citrulline protein antibodies to various citrulline antigens, they found that the more antibodies to citrulline antigens that were present, the more likely the patients were to develop arthritis. So this was very interesting. Patients who were double positive anti-citrulline protein antibodies and rheumatoid factor were more likely to develop inflammatory arthritis, as evident by ultrasound, over the course of 2 years. They then took this to the lab and they injected mice with anti-citrulline protein antibodies and found that they could decrease their pain threshold, so they experienced pain with tactile stimuli more than mice that were injected with control antibodies. And they also found that these mice developed tenosynovitis after the injection of these anti-citrulline protein antibodies. So they were able to develop an animal model for pre-rheumatoid arthritis. So not only did this group recruit 268 patients with joint pain and anti-citrulline antibodies that they followed for 2 years and found that about a quarter developed ultrasound evident inflammatory arthritis, but they created an animal model in which this condition could be studied. It'll be very interesting to see what comes out of this group in the future. I'm Jonathan Kay. For more information, go to RheumNow.